In other news, data centers. We always talk about data centers.
There's conversations happening in every community, I feel like, on data centers right now. And today is Sunbury kind of taking the lead on today's conversation, it seems.
Right.
We know that they took some action on this a few weeks ago. And, now we're kind of seeing the next steps unfold.
So, a few weeks ago, Sunbury passed that moratorium, like a temporary 1-year moratorium on that $2 billion Amazon project. But now we have some members in that community who want to permanently ban these large-scale facilities altogether. And we've kind of seen that as a growing movement across the state because we've already got like 300 some just in the state of Ohio. Even it changes every day. Even when we had kind of a panel on during the election, I remember a question being posed to someone up in Cleveland, one of the our reporters up in Cleveland, that, we don't have any up there. And then it was like the next day one was announced. So these are popping up everywhere. But opponents in there have gone around with a petition to gather signatures to get this on the November ballot. Now, some of the leaders of this movement told us they got 300 signatures, which is above the minimum required for Sunbury. So they plan to turn this into the municipal hall later this afternoon. If this petition is in fact accepted, Sunbury voters then get to decide this coming November if that ban gets to be a thing.
Well, and we've seen this in other communities too. There are some that a lot of them, obviously, they're very passionate about this topic. Grove City kind of sticks out to me a few weeks ago. I remember our reporters were at that meeting and there were a lot of people who were very, very against this. And we've seen that kind of become a trend.
It is a hugely passionate issue. I've joked in the past, I was like, it seems to be the one thing that has united both sides of the political spectrum.
United everyone. We can agree on something, guys.
Right. People might not agree of why to ban them, but there seems to be a very large contingent of people vocally against them. But then you have the other side of this, is that the reason these are all going in is because we are becoming more and more reliant on the cloud. Like everything that we do is now stored in all of this, our websites, all of that has to be stored somewhere, which are these data centers. And data centers have existed forever. It's just now that they're popping up faster and in places we didn't see them in the past.
Right.
As long as the internet's existed, we've had data centers. But now, we're seeing this, like we said, more and more things, even your iPhone, all the photos that you take, if you use iCloud, that's being stored in a data center.
Into the cloud, regardless of what cloud you've got.
Right. Everything we do. This show is hosted through a data center somewhere. I don't know where it is. But it's going through one of those. But we see that increasing need, that increasing use of online storage. But the other big driver right now is artificial intelligence that we really saw grow leaps and bounds in the last few years, using it in different aspects of everyday lives. In one place that's using it more and more are hospitals.
Yes.
So Kevin Landers took a look at how one hospital system is using AI to help doctors engage more with patients.
There's little debate that artificial intelligence is transforming healthcare. It's teaching future doctors like Brent Henderson,
any fevers, sinus congestions,
who practice patient interactions using AI-generated simulations.
And have you tried anything to either have these episodes stop or stop them from happening more frequently?
From helping doctors detect polyps during colonoscopies to identifying hidden blockages in blood vessels, AI is expanding what physicians can see and catch earlier.
The way I like to think about this is night vision goggles.
Central Ohio hospitals are embracing AI to improve the hospital experience. One example is called ambient AI.
It is game-changing for a lot of our providers.
Dr. Andrew Naselis with Ohio Health says before AI, patient visits often meant doctors splitting their attention between the patient and the keyboard.
Oh, I got to remember to put that down. Or I'm typing it. I'm turning. I'm typing. Hold on one sec. Let me type that in there so that I can take notes so that I have the ability to finish the rest of the note at a later time, right? There's that aspect of things that I no longer need to do.
With patient consent, ambient AI systems now record doctor-patient conversations and automatically generate clinical notes, sending them directly to a physician's device.
So, we do see that, that growth and how I'm curious how that's going to work.
Well, it's almost, I feel like talk to text.
Right.
Like I will admit, I do talk to text when I am logging something a source is saying in real time. I will literally turn on the microphone and just talk into my phone, and it writes it down. It'd be nice, I guess, if I didn't even have to do that.
Right. Yeah.
They just did it for me.
Some of those things like the talk to text and those, transcription tools have become such aids in our life,
Yeah.
I think. So, there are uses that can be found.